Hey, this is Dr. Neuhaus. I want to talk to you today about a mucoid cyst. That's a little cyst that can form on the top of the toes up right behind the base of the nail. You can see on the picture, the before picture, where he had this little cyst up on his knuckle. I had tried draining that in the office previously. I'd tried excising it in the office previously. So with that not working, having it recur over a period of months, we decided that we needed to bring it to the operating room. Most of the time I can get rid of these without a procedure like this, but this is a neat little procedure. So what I've done here, we're making an incision. I ellipse out the cyst, and I take it straight down to bone. A cyst like this is firmly attached to the tendon. Here it came out in one piece with a little piece of tendon actually all the way down to the base of the bone. A cyst like this forms from trauma. There's some sort of traumatic event that started this fluid production. It's this kind of a hard, rubbery type cyst that really is just very stubborn, hard to get rid of, and it rubs on a shoe and hurts. So what I've done is I've removed the cyst, and then I go in and open up the joint and cut a small piece of bone away, freeing up the tendon, and then I'll bring the skin edges together and close it up. It works great for eliminating the cyst once and for all. Again, this is it's called a mucoid cyst. Most of the time it doesn't require such aggressive treatment, but this was a very stubborn one. So you can see we take a little saw and just cut the surface of the joint, which was right below the cyst, and actually remove a small piece of bone that cyst was resting on and growing on. So you take everything out that was part of the problem. This patient's going to do great. The cyst should not come back. Even with as aggressive as we're being, nothing is ever 100%. And I have seen these come back not very often. Most of the time this is all you need to do. But removing a small piece of bone, removing the tendon that the cyst is attached to, removing really everything that's in there typically eliminates it. So the toe, it almost looks like the toe is ready to fall off, and that's pretty much true. I did all but cut the toe off in this case. So we wash it out real good, then we'll stitch the tendon back up so that the tendon is tight, and that will hold the toe, really that holds the toe together up on top, and then we'll stitch the skin up, and this patient should do very well. He'll have a little bit of pain afterwards. Usually the pain associated with this procedure is from the bandage. He's going to have a little bit of bleeding. The bandage will get stuck around the toe, so I have him change the bandage pretty quick after the procedure. A day or two later I'll have him back in the office, change the bandage, and then they'll just need to treat it with a Band-Aid, covering up the stitches, keeping it clean. Activity is tolerated, and they really should do this. People with this type of problem should do great, and within probably 2 to 3 weeks be back into a regular shoe, back into normal activities, just kind of pain permitting. He is going to have a scar in the area, but it's not going to be a very bad scar. The one thing that I typically will warn a patient about with a procedure like this, recurrence, of course, infection's a possibility anytime you have surgery, but with a cyst like this being so close to the root of the nail, you can have damage to that root with removal of the cyst, or even the stitching, because I'm going to have to stitch right through the part that grows the nail. So you can have some irregularity in the nail afterwards, but most people do great and don't have anything like that. So this patient will get numbed up, and that toe is going to feel really good for several hours after surgery. Get a light bandage on the toe, and that should hopefully be the end of the mucoid cyst. So another neat procedure. Hopefully that was educational for you, and thanks for visiting the website. It's Dr. Neuhaus.